So first of all, we are going to hear from Jean Lacy, who's the Executive Director of Entheo Illinois. Jean.
Hi, everyone. Thank you so much for being here today to share in this important conversation. I wear a lot of hats in this world, but first and foremost, I'm a mom. I have 3 amazing kids who are the driving force behind everything that I do and who I'm proud to raise in this great state. Professionally, I've been working in the cannabis industry since 2016. And in 2020, I founded the Illinois Psychedelic Society, a nonprofit organization promoting psychedelic literacy in Illinois. I am now proud to serve as the executive director of Entheo Illinois, a coalition formed to help lead the movement for psychedelic policy reform in the Prairie State. Now, for anyone who isn't familiar, psychedelic substances are a class of chemicals whose primary effect is to trigger non-ordinary states of consciousness. They range from chemicals to natural plants and fungi, and in spite of being Schedule I under the Federal Controlled Substances Act, are now being studied by major academic institutions for the treatment of a wide range of mental health and chronic conditions. The movement to legalize psychedelics has been ongoing for decades. One of our very own Illinoisans, Rick Doblin, founded MAPS, the Multidisciplinary Association for Psychedelic Studies, in 1986. MAPS is currently on track to receive approval from the FDA this year or next for the clinical use of a psychedelic drug, MDMA, for the treatment of post-traumatic stress disorder. Another local group in Madison, Wisconsin, the USONA Institute, has been studying the therapeutic use of psilocybin for nearly 10 years. Another term that you will hear to describe these substances is entheogens. The word entheogen is derived from Greek roots and can be translated to mean creating the divine within. Entheogenic experience has been used by indigenous people for millennia for healing, knowledge, creativity, and spiritual connection. This term is now used almost interchangeably with psychedelics to shift how we understand these practices, plants, fungi, and compounds. We're going to talk a lot today about how psilocybin saves lives. And while I'm personally so excited about the very hopeful potential for psychedelics in supporting the treatment of mental health and substance use disorders, chronic pain conditions, and so much more, I want to remind us that this movement is also about community, inclusion, harm reduction, and joining the broader movement to end the war on drugs for good. At the beginning of the modern war on drugs, conversations around psychedelic substances were banished to the underground. As researchers, practitioners, and advocates have worked toward bringing these powerful substances back into the light, they have had to increasingly reckon with the arcane infrastructure of our legal system. I'm here because I have experienced my own healing and personal transformation with these tools, and I continue to witness many of the people I know and love have their lives saved and radically changed by psychedelics. I have Illinoisans reach out to me on a daily basis speaking to how they've seen the news articles and all of the promising research and are desperately seeking the powerful potential these tools have to offer. The truth is, Illinois is in the midst of a mental health crisis. Traditional psychiatric interventions don't perform as well as people want them to. Some of them are even damaging. Psychedelics have been used throughout history with evidence going back thousands of years. We know that they are safe to consume, and yet unnecessary criminal penalties keep this consumption in unregulated underground settings. More people are using psychedelics than ever and need more education to make better informed decisions. We're asking that lawmakers in Illinois not let unnecessary barriers stand in the way of safe, compassionate access and quality assurance. In 2019, Denver became the first U.S. city to decriminalize psilocybin. Since then, several cities across the U.S. and Canada, along with the entire state of Oregon, have passed resolutions decriminalizing or deprioritizing the laws associated with regulating entheogens. Oregon and Colorado have passed ballot measures that will allow state-licensed treatment centers to administer entheogenic plants and fungi under the supervision of trained staff. Inspired by Oregon, advocates and legislators from Hawaii to Florida and a number of states in between, including ours, are moving forward to shift psychedelic policy. It's time we see past the paradox of medical versus recreational drug use. It's legal fiction. One of the most well-known places we see this bifurcation is in the cannabis market, but it's common with other scheduled drugs as well. The truth is that there are many reasons that people use substances. As human beings, we've always had a relationship with drugs in the forms of mind-altering and medicinal plants, including coffee, tea, alcohol, opium, peyote, ayahuasca, mushrooms, and more. When it comes to psychedelic, there is a middle ground, and many people will find healing on their own and without the help of traditional medical professionals. We have the opportunity to be more focused on how to bring everyone together for joint learning and have the participation of these different perspectives to build this into a diverse and sustainable ecosystem. Under the CARE Act, Illinoisans would gain access to this new promising treatment option through infrastructure for a regulated program that will provide for the supported adult use of mushrooms. Illinois has the opportunity to be a standard setter for other states, creating training programs, developing standards of care, and providing a model for other states to follow in creating legal access to entheogenic healing. Because of its ease to manufacture, the regulatory program will begin with psilocybin, but it would allow for other natural entheogenic medicines to be reviewed by the advisory board and considered for inclusion in the program. Under the program, adults will legally be able to seek supervised psychedelic-assisted therapy from a trained facilitator using natural medicines obtained at licensed service centers, which have been produced at licensed manufacturers and tested at licensed testing labs. The regulatory program is designed with important guardrails to promote safety. There will be no retail sales of the medicines, and the medicines purchased for facilitated use at a service center must be used under supervision and cannot be taken home. Facilitators will be licensed by the Illinois Department of Professional and Financial Regulation, and based on recommendations of the newly formed Illinois Entheogen Advisory Board, IDFPR will set qualification, education, and training requirements, as well as develop an oversight process, professional responsibility standards, continuing education requirements, and a compliant and disciplinary process. The initiative also includes funding for community education and harm reduction. The CURE Act also removes psilocybin and psilocin from the Illinois Controlled Substances Act, therefore eliminating criminal penalties for non-commercial personal use so that no one can be criminalized for seeking the healing medicines that these medicines can provide. Descheduling brings community-based use out of the shadows, creating greater transparency and accountability, and opportunities for education. It allows for increased safety for participants to report abuse or harm without the fear of being criminalized, and brings new opportunities for the research of entheogens in the state of Illinois. With descheduling, we can start to open up research and development and university involvement. The state of Illinois offers a highly educated and skilled workforce made possible in large part through the concentration of world-class research universities and institutions. There are opportunities to develop strong partnerships between industry leaders and research universities to provide the foundation for long-term growth by investing in and promoting research, entrepreneurship, and innovation. The benefits of these collaborations will be realized by private companies, research institutions, and consumers alike. So finally, how do we address equity in psychedelics? First, by pairing the removal of criminal penalties for personal possession with the expungement of past offenses and ensuring the movement to legalize psychedelics stays in line with the broader movement for harm reduction resources and ending the war on drugs overall. The drugs are not the problem. The criminalization of the drugs is what causes the most harm. Second, we can ensure equity by holding space for as many kinds of models as possible to emerge in this ecosystem to support a safe, regulated framework for all the various contexts in which people use these powerful tools. This does not have to be at odds with clinical models. Our priority has to be ensuring the opportunity for healing for all and consciousness without criminalization, so we must ensure other points of access. By creating structured education and open science models around psychedelics that allow for a practical continuation of care across the spectrum of health and wellness, educated peer and community support can provide the safety framework for supported use. And those who need professional level help in therapy and integration can find the providers willing to work with them. And lastly, we need to expand our definition of healing to include not only the individual, but the community as well. We only exist in the context of our relationships to each other, and we need to ensure the implementation of culturally competent programs that serve marginalized communities and that these programs are adequately resourced. In closing, I will say, the research and anecdotal data showing the incredible efficacy of psychedelics is a beacon of hope for so many across Illinois. We are in dire need for creative and new solutions to our crises of mental health and social dysfunction, both of which have been amplified by the harrowing pandemic that we've all experienced. The CURE Act allows for individuals to exercise choice regarding how to encounter psychedelic medicines. Medical access with psychedelics, as well as protecting personal choice and community-based healing, are both crucial pieces of the puzzle in making sure Illinoisans have the safety and support they need to navigate their own relationship with psychedelics. The use of psychedelics can be done safely when supported by the right care. The people of Illinois are capable of making our own decisions when it comes to our health and our consciousness. We all want competent facilitators, appropriate screening, preparation and integration for participants, and a safe, quality supply. There are serious consequences to continuing to withhold these medicines from the people who need them most. Thank you.